Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Parimala Devi. Dr. Parimala Devi is a renowned gynecologist and obstetrician in Bengaluru. And she has been the past president of OBGC also. And more than that, she is a very popular cardiologist as well as the robotic surgery. And more than that, she has set a Guinness World Record in screening the cervical cancer. More than her academic achievement, she is a very good human with a humane approach to her patients. And she is worried about the complications in her patients. And that is the reason she is today going to talk to us about the HbA1c. Many people may not know what is HbA1c, that is the hemoglobin A1c. And with the adult people, treating the diabetics patients, we know what it is. Regularly, we do it once in 3 months, 6 months, because this is the sugar attached to the hemoglobin that carries the oxygen in the blood. So whatever blood sugar is there, that sticks to this hemoglobin protein. And that's how we know this hemoglobin, it lasts for red blood cells, their lifespan is 90 to 120 days. And that's how we know whatever the average of blood sugar that was there for the previous 3 months, that is tested when we do the HbA1c. Now, what is that significance in the pregnant lady? You please tell us, Dr. Parimala Devi.
Once again, madam, my respectful pranams to you, the teacher who taught us. And today you are taking us more ahead with all your spiritual channel of Ahara, Adhyatma, and one more thing, Arogya, that is health. So this channel has got so much to give to the society, and I am so happy to be with you to imbibe all your blessings, which you have gone ahead some days ago towards Vaishno Devi, and you have come back with so much of glow. And I'm so happy that I'm with you today to share those few moments of blessings. This HbA1c today, why we have taken is it's something like, even though educated women, they will think that they can conceive anytime. It is not so these days. It was like that before, because the age of conceiving only was very normal. Something like
Yes.
20, 22, 24, they used to have already one baby. When the
By
body is
28,
very
they would have
compromised.
finished all their
Yes,
everything.
yes.
Yes.
When the body is very much compromised with a very good hormonal level around 24, 25, 26, that time they would carry the pregnancy, very healthy pregnancy without any metabolic problems. But now
Yes.
what has happened is, because of our that more empowering women and education is very important. I also agree. And people are career oriented. Women are also more now working women now. Because of that, they have to postpone their pregnancy. There is nothing like that. But what happens when they postpone the pregnancy? Women body is more hormone oriented. Because of that, there can be obesity setting in. There can be some sugar levels which are varying, and stress hormones releasing. Lot of PCOs we see, like a lot of PCO in young girls we see. PCOs are nothing but potential diabetics. That's what we
Yes.
say. Usually, if there are
Yes.
young girls with PCO, with increased weight, you usually counsel them. Now it is PCO for you, but once you conceive, it may turn out to be a diabetes. So
Diabetes.
control
Yes.
your PCO now only, and control your weight now only. We usually like that.
Yes.
When the is 20 years with PCO, now she comes with 32, 33 years, wants to conceive. If she wants to conceive, we have to see that she is in proper weight and her sugar values are normal, and she has got enough of the awareness, like how the pregnancy will go if at all there are some level of sugars are high.
High, high, high.
I mean to say, like, I am not asking everybody to do HbA1c and come to the doctor. But what is HbA1c? They never try to understand. They think that doing one sugar is more than enough. Once the sugar comes normal, it's all normal. It is not so. Because HbA1c is something like, it will tell about our Jataka. Jataka means
Yes.
our previous past history. Past history of 3 months, it will give whether
And also
we
it
have
will tell
diabetes,
future what will happen to the baby, whether
what
it
will
will
happen
have
to the baby.
hydrocephalus
Yeah.
or thing, all the
Yes.
complication, cleft
Yes.
mitral and spina bifida, all those complications, it can predict.
It can
Because if
predict.
she's
It's a
diabetic,
predictive
yes,
something
yes,
like that notes like it
yes,
will give.
yes.
But why?
So,
Because as you said, very clearly said, the hemoglobin is one content of the RBC, where this hemoglobin, that protein in that, iron in that, will catch up the sugar in the blood. As long as the sugar is not entering the blood, everything is fine. But as long as pancreas is managing it, liver is managing it, things will go well. But just because body can take, we keep on taking unjudiciously all the sweets, increasing the weight, and not doing any exercise means suddenly there can be lot of sugars where the body have to keep. It will start pushing it into the blood vessels actually. That
yes.
time when we do the HbA1c, this blood test along with fasting blood glucose, then fasting blood sugar, then we will come to know some values like 5, 5.5, 6, 6.5, 7, more than 7, more than 8. So maximum, like we don't want any HbA1c to be more than 5.5 or 6 actually. But if it is
Okay.
6.5 also is okay. But if it is
Hmm.
more than that, we have to alert the woman. You have to reduce your weight. You have to bring down your diet patterns, and then
Hmm.
only you should plan to go for the pregnancy.
But
Because
if a pregnant woman, if she comes in the first trimester, and if the HbA1c is 6.5, that means she's diabetic. If it is less than that, she's pre-diabetic. So your treatment for the diabetic patient will differ from the pre-diabetic, no?
yes, yes, that is there. But in pre-diabetic, at least we can start some tablets. If it is, she is not
Yes.
coming down, whatever she does from 8.59 to, she might have come up to 7. Up to 6.5 she comes, that is beautiful because we can start her with some mild dose of some of the anti-diabetic drugs, and then we can take her to conceive and to carry the pregnancy. But if she
Hmm.
starts her pregnancy with 8, 9, 10, something like that,
That is
definitely
very
baby is going
dangerous.
to have some abnormal organs, because
What are the
baby can have.
abnormalities?
Yes, when she should not start pregnancy with a very high HbA1c. For example, something more than 7 we can say. Then out of the rules, every rule has got an exception. They may come with normal pregnancy, but majority they can have abnormal baby, or the baby may not develop the heartbeat only. Especially the cardiac problems are more when there is a
Yes.
HbA1c is more, because the
Abortion
sugar
may
is going to
occur,
affect
or
all the
there may
valves
be
of the heart.
yeah. Hmm.
Yes, and the brain development also can be a problem. There can be a lot of fluid collection in the brain, and so there will be a big head baby. Like they used to tell, like
Hydrocephalus.
it is something like demon baby or big baby. Something it is
Hmm.
not a normal baby, or it may be a very small baby, not growth developed properly at all, growth retarded baby,
Anencephalic.
or
Hmm.
it may be half head baby, anencephaly.
Hmm. Hmm.
The brain will be totally seen actually. The whatever the bone skull will not be
Hmm.
developed only. These are some of the
Hmm.
very like horrifying problems which
Horrifying.
pregnancy
Yes.
that fetus is going to have. So the women have to be very careful, especially if there is a hereditary in the family that both parents are diabetic, and already there are some 1 or 2 abortions in her, or if she has given birth to a very big baby of more than 4 kgs, difficult labor in the previous history, and her age is more than 30, 32, something like that, and her weight is more than whatever the BMI we expect, more than that expected BMI, then she have to be very careful to plan her pregnancy. First she have to control herself, her hemoglobin C and other hormones also should be seen. Even her husband also have to be cooperative, so that they will come to a conclusion that we will conceive the pregnancy only after our hormonal level, and also especially our
The
this
blood
sugar
sugar
level
levels are
HbA1c
low.
comes to normal. Because
Oh.
unnecessarily hurrying up for pregnancy may invite lot of problems. So
Hmm.
these are few things, because before we had for 100 pregnant ladies, one
Hmm.
pregnant lady would be diabetic. When she comes in 4th month, 5th month, little high sugar she may show. But now in
Okay.
the modern world, because of the sedentary work, because of the processed
Junk
food,
food,
the diet,
and
the
altered
erratic diet.
lifespan. Yeah,
Yes,
erratic. Hmm.
yes. And also some women may be having, because of the society and all, that high level
Alcohol,
of living, alcoholism, smoking, and always eating something like the processed food only, like this bread and maida related foods,
junk food.
junk
Yes,
food. So all these things can definitely give a big toll on the pancreas. We have to
yes.
really pity our pancreas, because pancreas is one organ which is on the right side, next to left side, on the right side is liver. Pancreas produces always some good amount of insulin. That
Hmm.
insulin will churn all our fat and see that the sugar levels will be always kept under control. But if we
Yeah.
keep on pouring and pouring the sweets and everything to the body, how much pancreas also can produce this hormone, insulin?
Yes.
Then it will
Yes.
become tired. That is what we call it as insulin resistance. When
Yes.
insulin resistance happens, it's very
Mm.
difficult to control the sugar values,
Mm.
especially HbA1c. So
Mm.
my humble request is to see that you develop a kind of status like Garbha Sanskar, where you
Mm.
are going to take care of your body weight, your
Mm.
habits, especially if you have some habits of
Eating
smoking,
habits
please give it up.
and not to have stress. That is also very important.
Yes, stress.
Stress
Stress
induced
also is one
diabetes
important.
also can come. Yes.
Yes, yes, all these things. And also to see that your like protein intake and the vegetables intake, everything is very normal. And you will stick
Mm.
to your some mild kind
Healthy
of
habits.
exercises and
Mm.
proper BMI of your body. All these
Mm.
things you cultivate, and even your husband have to cooperate with you by giving up his smoking habits, his habits, because
Mm.
even his passive smoker also can take
Yes.
lot of
Yes.
trouble. You think it
Mm.
is because of diabetes, it may be because of the smoke also. There may be some problem on the baby and the
Mm.
mother. So all these things have to be totally put into action before
Mm.
she embarks on the pregnancy, I can say. So
Okay.
HbA1c has got lot of importance.
Mm.
People have to be very much aware. Not that we are telling first to
Mm.
do HbA1c and then plan for the pregnancy, but if we have something like there are some risk factors, because our
Yeah.
country is now diabetic capital. You were telling,
Yes.
madam, actually
Yes.
diabetic capital. So
Yes.
in that state, we have lot of pregnant ladies coming with the gestational
Mm.
diabetes.
Mm.
That is
Mm.
diabetes in pregnancy. So to
Mm.
control
Mm.
that, we have to see that all
Mm.
these rules have to be followed. Otherwise,
Okay.
they may end up with some abnormal baby, or a baby with some cardiac disease, or a baby with very less weight, or very big
Macrosomia.
macrosomic baby.
Macrosomia. Yes. Yeah. Very correct.
These
And
things will be the
in
result.
yes, yes. The audience should know that our viewers that normal HbA1c is 5.7% and pre-diabetic. That
Yes,
means they are likely to be diabetics is between 5.7 to 6.4. But if a pregnant woman
yes,
in the first trimester, if she has more than 6.5, that means she's definitely diabetics and she must
yes.
have the control of the diabetes before she becomes, continues her pregnancy, so that, as Parimala Devi said, it is like a jataka or a horoscope. It
Yes.
tells the past
Go.
as well as the future.
Yes,
If you don't want any anomalies in your child and you want to have a healthy baby, then you must control your diabetes and alter your food habits. Go back to the healthy foods like taking more vegetables and more fruits rather than eating the junk food. So, thank you very much, Dr.
thank you,
Parimala Devi.
madam.
You have given such a beautiful explanation and told them how important it is to become pregnant before 28 years and also control the diabetes before you become pregnant. So, thank you very much. And
Thank you,
I'm
madam. Thank
sure all our viewers will take your words of wisdom and then follow you properly. Thank you.
Thank you, madam. Thank you so much.